Hi everybody, this is Dr. Jared Wooten here from Wooten Family Chiropractic here in beautiful Cordova, Tennessee. I wanted to create a video today to talk about sleeping position. I get it from my patients all the time. Dr. Wooten, how should I sleep at night? Dr. Wooten, I sleep this way, is that okay? And I just wanted to create a video to give you more information to be able to help you live a happier, healthier life. So when we talk about sleeping position, it's important because if the average person sleeps anywhere between 7 to 8 hours a night, by the time we're 45 years of age, we've already slept 15 years of our life away. Okay, so the first position that I'm going to recommend, and really it's my favorite position, that's sleeping on your back. And it's going to be important because when you sleep on your back, that's when you're able to put your spine in the most neutral position that it can be in. Reinforcing with a cervical pillow, also with a firm mattress as well. The firmer the mattress, the better, because the curves do need to be supported in that area. Okay. Now, here's one caveat though with sleeping on your back. If you are blessed in the Bay Area region, and I'm not, but if you are blessed in that region, you may want to put some pillows underneath your knees as well when you're sleeping. What that does is it takes the angle off the low back here, helps it to get into a more neutral position as well. So that's sleeping on the back there. Now the second position, and it's a very distant second, but it still works for some people, and that's sleeping on your side. Now be very careful when you go to sleep on your side. I call it the mirror image position. Make sure that when you're sleeping there, you've got your hands touching or your elbows are mirroring one another. Same with your knees. When you're sleeping there, make sure your knees are mirroring one another as well as your ankles. Some people can put a little bit of tension on their hips, so if you need to, go on and put a pillow between the knees there as well to take some of the tension off. Now, a reason I'm not as fond of the side position as I am laying on the back is because very quickly you can find that once you fall asleep, you end up lying on your arm, your hips end up getting tilted and cocked to the side. So if you do sleep on your side, make sure you're very intentional about maintaining the mirror image position. Now the worst position that you could sleep in, and that's going to be on your stomach. And a lot of people choose to sleep in this position and it feels comfortable to them, but I gotta tell you, it's not good for your back at all. Okay, what happens when you sleep on your stomach, you're actually throwing your spine into extension. And what that can do over time is begin to jam up those facets, which can cause more inflammation and more pain in the long run. Secondly, when you're lying on your stomach, you have to be able to come up for air, right? So your head is cocked all the way to the side here just to be able to breathe. And as you can see, in the long run, if I were to do that for 7 to 8 hours, I'm going to begin to develop some cervical issues as well that can result in neck issues, but also numbness, tingling down to the arms and hands as well. So do yourself a huge favor, and if you're not doing it now, try to begin the habit of sleeping on your back. You know, people say to me, "Oh, but Dr. Wooten, I sleep this way and that way, and when I wake up in the morning, I'm all over the place." And I say, you know what, just try your best to start out right, and if in the middle of the night you wake up and you're clear over to Timbuktu on the other side of the corner of the bed, just put yourself back to the neutral position on your back where you should be. And I think if you follow those instructions, you're going to be great when it comes to your sleeping position. Take care. This has been Dr. Jared Wooten from Wooten Family Chiropractic here in beautiful Cordova, Tennessee. We'll talk to you later.